But how are hospitals feeling about the relaxed restrictions? Let's hear it from Jose De Grano, President of the Private Hospitals Association. Dr. De Grano, welcome to The Big Story.
Hi, Robbie and Gretchen. Good evening.
Good evening
Yes,
po.
okay.
Ay, Doc, hindi naman
Okay.
natin mapapagkaila. Everybody
Yes.
has a level of excitement. The entrepreneurs, of course, businesses, mga pamilya, gusto kumain sa labas, pati mga gusto magsimba. But how do you feel at the front lines?
Well, because of the continuous decline in the number of cases, okay naman. And then there's still a little bit of a decongestion of our hospitals as regard the COVID cases. Now, I think we really have to, perk up the economy, as they say, But still, we just have to strictly follow the minimum health standards because let us all remember the threat is still there.
So we're hoping for the best but preparing for the worst. In terms of preparing for the worst,
yes.
how prepared are we in terms of resources? Not just, gaya nga po sabi niyo, lumuluwag, but the age-old problems natin sa mga ospital, particularly pagdating sa human resource, ready po tayo dyan?
Yes, of course. The hospitals have more or less they have a respite for a few weeks, and then but still, if you will note the same number of let's say 30,000 active cases in February, we only had around 2,000 hospitalized people, but now we are still having around 9,000 plus in the hospital. So still. We have to be careful of that. For me, it's still a guarded condition or a guarded prognosis for us.
Speaking of being guarded, how is the situation in hospitals outside of NCR po? I mean, the farther we get from urban centers, how are hospitals and health centers doing?
Well, more or less, everything is continuously declining also. The hospitals are already decongested in other areas. So the only problem, the difference between NCR and the other regions is we have a higher percentage of vaccinated people in NCR.
Okay, Dr. De Grano, maraming salamat po.